Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be talking about something called latent autoimmune diabetes of adulthood, LADA, otherwise known as. And what I wanted to mainly focus on is the fact that this is a commonly misdiagnosed condition. And a lot of times, this will behave as type 2 diabetes, but others say that it should be called 1.5 uh, diabetes 1.5, which means that it has some characteristics of diabetes 1, type 2 diabetes, and then some characteristics of type 1 diabetes. Let me explain that a little bit further. So if you have, if this is something that has an autoimmune component, that's behaving like type 1 diabetes. But the type 2 diabetes is similar symptoms, and there's actually a anti-LADA antibody which goes after that. So when I was writing this, one of the things that came to mind, and I've actually worked with collaborators here at at the Sacred Heart Hospital. So when I was writing this, I was thinking that how best to uh, how best to operationalize the idea of LADA. So I decided to start with comparing this to type 2 diabetes mellitus. And so, because this is on the rise and it's unrecognized, I would presume that there is underdiagnosis of this illness or improper diagnosis of this condition. So, 12% of all adult onset diabetes is actually LADA, and it's known as uh, glutamic acid actually this is not, but glutamic acid decarboxylase is an enzyme with the role of breaking down glutamate to carbon dioxide and GABA. So GADA, that's what the glutamic acid decarboxylate on antibody stands for. Um, that increases, LADA increases. So the diagnosis and treatment of LADA, how do we diagnose this? Well, there's an antibody, like I was saying, against not only islet cells in the pancreas, but also circulating through the body. As with any other autoimmune disease, anti-rheumatic conditions, uh, DMARDs are a good option. However, when we're looking at so DMARDs are uh, disease-modifying anti-rheumatic drugs. Uh, so infliximab, some of the biologic biologic agents which are uh, used to treat against diabetes can be helpful, and infliximab can be helpful in reducing some of that antibody load. So then we looked at some of the research articles, and you might find this a bit dated, but at the time that I wrote this article, it wasn't dated yet. So Huang et al., the role of zinc transporter um, and autoantibody. So the zinc transporter can be used to differentiate between LADA and type 2 diabetes. Very important distinction. And these autoantibodies should be actually common practice to look after. So Ipadiola et al. Um, it was investigating the frequency and characteristics. Uh, they characterized this, and there's no clinical differences found between LADA and type 2 diabetes mellitus. Using GAD antibody testing even more is more important. And you can go through the rest of these. I have about uh, 7 articles, actually 8 articles. So you can go through these 8 articles and determine which one is the most important. So just wrapping up, potential solutions is looking at that the thyroredoxin uh, interacting protein, which I've discussed in other lectures. Um, and so, according to previous studies, researchers found that high blood sugar can cause the human body to produce a protein called thyroredoxin. So, if you target something uh, against the thyroredoxin, uh, then this will be better. So, um, thyroredoxin plays such a significant role. So, TXNIP is thyroredoxin interacting protein. So, in fact, thyroredoxin interacting protein plays such a significant role in beta cells within the pancreas. So expression of mRNA, beta cell function, and insulin production. So the beta cells, by the way, in the islets of Langerhans within the pancreas are actually the ones that release glucose. So once the autoimmune attack gets rid of that islet cells, beta cells, then we're in trouble. This leads to uh, this leads to diabetes. So in the presence of diabetes, this protein is increased. That's important to know. And actually, I worked with an endocrinologist who actually diagnosed somebody with LADA. Of course, in clinical practice, may not necessarily known, but regardless, you're kind of looking for looking for similar treatments. But what is interesting is that treatments like DMARDs are actually agents that may prove to be a solution. But these DMARDs are actually biologic DMARD agents. Uh, so other forms of immunomodulation may be necessary in order to effectively treat LADA. So like I said, the antibody was tested and it was found to be positive when I worked with the endocrinologist here. Um, so these are all good things to focus on. The protein, the antibody that goes against the pancreas creating LADA, and some of the articles, 8 articles to be going over. So if you cover all of this, you will know all there is to know with LADA. Thank you for listening.